name is Bruce Baltz. I'm with Baltz. I'm Vice President of Education and Business Development. We're at Oakworks right now. We're working on a Prolex table with the ABC system. What I'm going to be sharing with you today is some active isolated stretching principles that was developed by Aaron Mattis. I had the opportunity to study with Aaron for about the past 7 years, and I'd like to share with you some things that really changed my approach as far as stretching and clinical massage is concerned. When you want to stretch the hamstrings, you have to stretch the gastrocs first. You've got to stretch the back of the legs because most often you have a pull in the calf when you're raising the leg up off the table. So by cradling the heel and putting my forearm into the foot, you want the client to be active. So you're going to ask your client to contract tibialis anterior to then move their toes toward their knee. In that process, when tibialis anterior contracts, it sends a signal to the gastroc to let go. So now the body's communicating with itself. And so in our process, we only hold stretches for about 2 seconds, and the client is active. And then they have to release, and that's when the new blood and oxygen comes back into the tissue again. Okay, so contract and pull for me, and then I just lean forward. A little bit extra pressure, and then relax. And again. Most people, when they're stretching the gastrocs, will just do one stretch. For us, we have several stretches because we realize that the gastrocnemius is a very wide muscle. That one angle coming up in a neutral position gets the middle belly. And when the leg's down on the table like this, we're just getting the distal part of that middle belly. If we want to get more lateral, we need to change the angle of the foot. So in this case, if I invert the foot and support it the same way I did on the first stretch, and now have you draw your toes back, it changes the angle. So we're going to be working the oblique fibers on one side of the gastroc, and then if you evert, and we do the same thing and pull back, now we're going to be getting the other side. So now we're getting much more blood circulation into the posterior compartment of the leg, so then we can have a better chance of getting an accurate or deeper stretch into the hamstrings. This can also be done at different levels. The stretch is going to be much deeper in this position. Again, we'll do neutral. Then I can turn. It doesn't matter if you turn the ankle in or out first. If we turn in and then pull back, the client feels a different stretch each time. And now turn out. We usually do about 10 repetitions. Doing a total lower body stretching program takes around 2 hours, just because of all the detailed work that Aaron was able to develop, doing so much clinical work over the past 40 years. Now when we want to get into the hamstrings, we're going to bend the knee first. It's a 2-joint muscle. So we want to stretch at the knee first, and then we'll do the actions at the hip. So from this position, we drop the knee down and just extend your leg up for me. And then back down. And as that muscle starts to open up, I start moving the femur forward. And then we'd extend again. You want to be able to lock the knee out with each stretch. And again, doing about a set of 10, we find it is enough to really increase the range of motion. Then after we get the distal part done, in the neutral position, then there's also rotation at the knee, which is done by the hamstrings as well. But most people don't stretch hamstrings on a rotation. So again, we can internally rotate, and then we can extend. And then we can externally rotate, and then extend. We have 3 different hamstring muscles. We have bicep femoris, we have semitendinosus, and semimembranosus. So by that rotation, we can emphasize one side or the other. Now when we want to get more proximal, we're going to lift the leg straight up from the table, which is probably the more common stretch that people do for hamstrings. So you're going to be lifting right from the hip, keeping the knee straight. So lift for me. I try to stand behind the work. The client is lifting. The client is always active. So lift again. So then when I'm behind, I can lean in, where I don't have to just be pushing with my arms. So again, there'll be 3 positions. That was neutral. Then we can internally rotate from the hip. And in this angle is going to come more down the center of the chest. So please lift again. Here. And my hand position is important here because I want to help maintain that angle of that internal rotation. If you're here, you're going to push the client out of their rotation. I mean, make sure you have the right hand position. and then you come back down to the table. For this stretch, you have to come all the way back down to the table because we want a full contraction of the quadriceps and the psoas as we lift the leg up. So neutral is back down on the table. That's when the blood and oxygen comes in. Then we can externally rotate. Now you're going to lift this leg, and I'm going to guide it toward the opposite shoulder. Again, rotational fibers of the hamstring. So this is a little bit of basic information on active isolated stretching. You can find more information on our CE programs at bonvital.com or call us at 800-253-6466. Thank you.